Musbah Razak of Joy Sports and also of Joy News is here to take us into the details of this documentary. Musbah, you know, immediately you hear Mothers in Peril. I mean, it just starts, you know, letting you think about a lot of inadequacies that we have in some parts of this country.
Yes, and this documentary is going to explore it extensively. We're going to talk about the rural health facilities that we have in the country. A lot of them have a number of challenges, but this time around we're going to focus on the challenges that these facilities have and how it's affecting mothers, especially, you know, mothers in labor. And for the documentary, we're going to see that some of these facilities apparently do not have basics such as water, they don't have toilet facilities, and these are necessary elements of a health facility, especially for mothers who are looking to, what do you call it, give birth. So those are the challenges that they have, and our story explores it extensively, and we're going to have a conversation on the back of that also.
Interesting, but you know, it just, you know, gives you loads and loads of chills, because if you are used to the urban side of town, you'd know that these things are regular, but then you go outside of Accra, go to certain towns, go to certain villages, and these same people, same Ghanaian citizens, have so much inadequacy, especially in very, very critical, you know, health conditions. You know, childbirth is a very, very sensitive process which has to have the best of hygiene. But unfortunately, that's not the case.
Yeah, that's not the case. And it's even more shocking to learn that there are some mothers who even have to carry their own water to the health center, you know, so that they can clean themselves after they give birth. So it's going to be a really touching documentary, which we want you to stay tuned and watch, because it's coming your way very shortly.
This is Konkwa, a small farming community in the southwestern part of the Bongo district with a population of over 1,000 people. This small community-based health planning and services CHPS Center is the only healthcare facility here. It has 3 small rooms for different consultation services and a sizable open space for a waiting area. Next to it is a small structure with rooms for the accommodation of 2 healthcare staff and an extra room used as a delivery room. Both pregnant women and nursing mothers come here for antenatal and postnatal services, but the facility has no access to water and no washrooms or toilets. Mary Ania has been coming to this facility for some years now. She received antenatal care and delivered her second child in this facility.
After I gave birth, because there's no water here, I have to send my sister to go home and carry and bring me water so that I can take my bath here. It's very far from here. So she went home and brought the water. So I took my bath and the midwife to take over. I went home and came back here with rashes all over my baby.
Like Mary, these 2 expectant mothers coming for antenatal care are facing similar difficulties due to the lack of access to water and sanitation facilities. They say they are not even able to collect their urine samples in a dignified manner for lab tests.
Before the time de lebukuril in so ngalaka bole inyela awam bata tabba ho kalan to lebukurire ka so inye balala ma nan lebukuri o obati yirma tuku wana to so balala me lawantere selonde le yume de before to so inyela balala ma waka tara ba aboro ho poro halame.
First time ma wakala ti inge we minga nandore zete te kador ma kumi masen ze kadore esalam de un tenga Oi tu zel do nerva biro ko be ona senka lilizia dore. Mambete ya hanya ne isornga bonito la bangradeko la sonto.
The healthcare staff here at the Bongo CHPS Center have to rely on kind community members who volunteer to bring them water for their hand washing setups. Gifty Amo, a senior nurse here at the facility, explains that it is difficult to avoid spreading infections while working under these circumstances.
When I have a case and I want to wash my hands, I'll come here and pour the liquid soup to now wash my hands. And I'll now open the tap, wash it into this basin. So when it's now done like that, I have to carry this basin to outside to go and pour the water away. But in case the tap is not flowing, I have to use my soiled hand to hold this cap and open the basin to fetch water, which is very bad because if I use my soiled hand to touch this cap, that means I've contaminated the whole water, which is very bad because it causes infection because I've transferred bacteria into the water. So at the end, the whole water is not safe.
The story at the CHPS Center in the neighboring Gori community is not too different. The healthcare facility was provided with a hand pump borehole. So, although there is a source of water supply, the water does not run through taps in the facility. Women seeking maternal healthcare services, therefore, must come to the borehole with buckets to fetch water before being able to use the washrooms. This structure outside is the urinal used by all clients at the facility. Inside the facility itself, there is a small maternity ward with a washroom attached. However, since there is no running water, the mothers or their relations accompanying them must go out to the borehole, which also serves part of the Gori community, to get water and bring it back to the ward for use. This exposes the mothers and their babies to the risk of infections. These two young women have once delivered babies here at the Gori CHPS compound and are expecting once more.
Nera tambera mukurani wa awapaka tibale mandeke yeti titoti ensenga dinko na leti so ta yeti di tinin dira tin tarakram pa so ko na taladang mayon do akala 3 years ntole makanye ko woso so makanye ko wosala mampu kanye ko wopi de yok biyela tamo so biyela makasole tamo ara de ala bilayom ba ti biyela yom berama so mayon do ba mayu kanye ko woso no mayu gamba la hale to yu yan kai him sinya kuli ya ta so iso ngala puana mi iso ngala mi kele foli kutsema akinzam la to anna ta bone inside and ni sinka door ba de flash.
Next, we visit the Biontankon community, also in the Bongo district. The healthcare facility here is also a community-based health planning and services CHPS Center. It receives hundreds of clients daily, many of them mothers seeking maternity services. But this healthcare facility has no access to water and has no washrooms, toilets, or even a urinal. When the women here need to use any of these facilities, they must go to the nearby homes and hope to be permitted to use their facilities. Otherwise, they have to improvise by using a cloth to cover themselves and hide behind a tree or a rock.
When I was pregnant, it was very difficult. Water was the main problem. When we come and they give us the malaria drug, where to get water, it was difficult. Some of us, when we are coming, we don't have money to come and buy pure water. And we don't also know some people here, whether they clean their containers before fetching water or the hygiene they are doing in the house, we don't know. We'll go and just collect the water like that and come and take the drug. To wash our hands too, it was a problem. When we want to urinate, another problem.
For you to get urine for the test that you are pregnant, it's always difficult. So because of that, they normally hide until the pregnancy will show up before you come. Because if you come, where to even enter and do urine for the test is the problem. And we don't have toilet. If you come here and you are feeling like to free yourself, unless you go home.
Because of this situation, deliveries are not conducted here at the Bongo CHPS compound. The mothers come here for antenatal services until they are due for delivery. They then go to another facility in a nearby community to deliver their babies. The journey is often difficult and becomes treacherous during the rainy seasons because a large river separates the two communities. Irene Akologo, a pregnant mother, has already gone through this ordeal.
When I was to deliver first, it was not easy. I struggled. After crossing the stream, we have to cross a river again before we now get to the clinic. That place too, there was a lot of water. We normally go with our mothers, so they helped me to cross. So the time I get there, I was weak. The time they were even saying push, push, cry for the child. So when the child came out, it was fast. The child couldn't cry. They said it has kept long. So the time for the baby to come out, it delayed. I was thinking that I even lost my baby. But God being so good, the child was alive.
The situation has not changed since Irene had her last baby, and now 5 months pregnant again. She will be due for delivery in August, the peak of the rainy season in this part of the country. She is likely to face the same ordeal she faced during her last delivery 2 years ago.
It's 2 years now, and I'm 5 months pregnant again. So as I'm here, as my previous time, even how to walk and go to the first, where we get the water, is far. The time you get back here, you are always tired. And to deliver, we have to go to Walka, which is far. Even if you are approaching to deliver, if you are up to 28 weeks, they have to send you to Walka so that you'll be going there to see the midwife, which is far. You cross the river, and walking like that is not easy.
The Namung Healthcare Center provides healthcare services to thousands of people in the border town of Namung, here in the Bongo district of the Upper East region. In addition to regular outpatient services, maternity and child welfare are the predominant services provided in this healthcare facility. On average, 40 women come here daily to receive maternity services, and a minimum of 35 newborns are delivered here every month. However, wash facilities here are not commensurate with the high number of clients. Although there is a borehole here providing water, only the maternity room of the facility has washrooms and a toilet. The physician assistant here at the Namung Health Center, Halima Sadia Adamu, explains.
And at the maternity unit, we can receive about 30 or 40 mothers a day. Some will have to also produce urine for testing for the ANC clients. The postnatal clients, some of them also have to use the washroom. And at that unit, we have only 2 urinals and then the toilet. And so with these 2, with the population, I think there's an impact of the 2.
So that's a very striking documentary there, telling the story of our counterparts in the Upper East region, Bongo to be precise, whose health facilities are in a very dire situation, because if you talk about health facility not having something as basic as water, then you wonder why it's even termed a health facility, and even what the indigents there are going through. Well, in studio with me is a rep from WaterAid who have been on this very subject for several years and have spent quite a lot of resources to try and drum home the need for government, for any other person who can help support, with water, sanitation, and hygiene-related issues. And he's the head of strategy, policy, and campaign at WaterAid Ghana, Ibrahim Musa. Thank you very much for coming. I mean, this is a very, very striking documentary. And I'm just curious, first of all, the key things you learned from this story that was shared with you.
Thank you, and good morning to you, and good morning to your cherished viewers.
Yeah.
And thanks to the partnership with the multimedia, Joy Prime, Joy News, on this documentary. For us in WaterAid, I mean, the summary of the lesson we've learned is, from this documentary, is to shed light on crisis that is in plain sight. And I say in plain sight because from the documentary, you have listened to the women who go on daily struggle. I mean, visiting healthcare facility to access healthcare, but rather challenging without actually adequate water, sanitation, and hygiene.
Yeah.
And that should not be the case. I mean, water flowing in healthcare facility, availability of toilets, and hand hygiene should be basic, like you mentioned.
Basic, yeah. Very basic.
But these are the struggles that the women go through.
And even, I think there was a portion of it where it tells the story of women who sometimes have to bring their own water when they deliver to thicker. But I can't imagine, my wife in future having to go through that, because, and for a lot of people in the city area, they're not used to this. When they hear these kind of stories, they wonder, is this really happening? But yes, it's happening in Ghana. But the big question is, how long has this been going on in the Bongo district?
So if you listen to Madame Estella, the district health director for Bongo district, I mean, in the documentary, she revealed that Bongo district health administration has been in partnership with WaterAid over the last 10 years on our WASH in Public Health program, trying to remedy these challenges. So it means that this is an age-old problem. But like you mentioned, if you listen to the interviews by the women, the doctors will tell you that after delivery, there is common infection they call sepsis.
Sepsis, yeah.
Which is prone to children at birth. And one of the ways that doctors, nurses, midwives can prevent sepsis is adequacy of water. Because at the point of picking the baby, you need to wash your hand.
Yeah.
To be able to pick the baby, to prevent any, infectious material you will have lay your hands on and all that. I mean, so sepsis in neonatal, is common. Yeah. And it contributes a lot to neonatal fatality. So that is one area that we feel that, look, if water is available running through the maternity, but in every part of the facility, then this can be reduced.
Yeah, and one of the things that strike me is that I got to learn that the Bongo district apparently has a dam. Yeah. And in that Bongo district, there is a Ghana Water Company facility there, but supplying water to other parts of the region. Yeah. Yet that very district and health facilities do not have access to water. Absolutely. And I'm wondering, why is that the case? And they have a dam.
Yeah.
The Ghana Water Company have got their offices there. They're supplying water to other parts of the region. But the health facilities in the district which is hosting them do not have water.
And that is what we call the water justice issues. I mean, because Via Dam is located on the land of Bongo. Ghana Water has their treatment plant there. The water is abstracted, treated, and mind you, the Via Dam is one of the nicely protected dams. So you can see the goodness of the people of Bongo. They have kept the dam neat, unlike other dams in other parts of Ghana where it's heavily polluted. This Via Dam is nice, protected by the people. Yet the water is drawn, supplied to the Bongo, Bolgatanga municipality and other parts, and only the communities in Bongo closer to Bolga are benefiting. But the chunk of the district where most of these rural chips compounds are located don't have water.
Wow.
And this has been going on for close to 30 years or so when this Via Dam was released to Ghana Water Company to supply water. So the question then is, what have the people of Bongo done? They are just now calling on government, i.e. Ghana Water Company, Community Water and Sanitation Agency. Interestingly, and the good thing is that Ghana Water Company is in charge of urban water supply. Community Water and Sanitation Agency is in charge of rural water supply, and both are government agencies. So it is easy for them to go into partnership to solve this problem because Bongo district is having serious hydrogeological challenge of not getting adequate safe water because of high fluoride concentration.
Okay.
And so if there is safe water that Ghana Water is able to pipe to Bolga and other parts, it's only normal that Bongo district gets it. Meanwhile, from what our interactions with Bongo, the people of Bongo district, they are not saying that they need the water free. Just like any household that gets connected to Ghana Water and pay water bills, if the water is given to them, they will also pay. If the water is connected to the healthcare facilities, it aids in quality of healthcare, to the people.
I'm sure within this 30 years and even the last 10 years that you've been working with the health facilities in the area, I'm sure you've equally been engaging government on this issue. I mean, for all the years we've been engaging government, what have they been saying? What have they been saying to you in relation to this problem? Because if they've been committing to resolve it, and for 10 years, this problem is persistent, one will wonder, is it a lack of political will? Is it that they just don't like the people of Bongo? And that cannot be the case.
Absolutely. And I like the way you put it. If we want to believe that they just don't like, I don't want to believe so because the politicians go and take the vote of the people of Bongo, if for nothing at all. And the people of Bongo are Ghanaians.
They are Ghanaians.
And look, it will marvel you to also even learn that apart from the Bongo people being Ghanaians and they have the inalienable rights to resources of Ghana, also Bongo has resources. I mean, you talk about shea nuts, you talk about other foodstuffs, vegetables and all that. It comes from there. So it's only befitting that Ghana Water and Community Water prioritize this issue. And for us, we're even happy that His Excellency President Mahama has launched the big push. So if even adequate budgetary provision was not made to Community Water and Sanitation Agency and Ghana Water in 2025 budget, the 10 billion big push program by the President, His Excellency, can be gotten. Part of it can be gotten to solve this problem.
And I think, look, sometimes it strikes me to learn this, that the people, because just looking at the demographics there, relatively the people in Bongo are not well-to-do in terms of the economic status of the people there. These are people who are making a lot of effort to try and make ends meet. And then the health facilities are not at the very highest level. They are having to make do with chip compounds. And then they have to suffer some of these crises. So, it begs the question, is this... I'm just trying to wrap my mind around, because I can't imagine a woman having to go through 9 months of pregnancy, all the issues that come with it. Then on the day of delivery, they have to go through this. Because I understand because of that, some women even have to, long distance to go to other communities to go and deliver when they could ordinarily do so. Recently, the government spokesperson announced that the government is going to invest in excess of 6,000 CHIP compounds. All right? If that is the case, facilities like in Bongo CHIP compounds, which already exist, clearly need some, what do you call it, retooling. Absolutely. They need some basics like water. Absolutely. And I think maybe the direction should be turned there. You know, are we having an issue of priority? Because that seems to be where we are circling around, because we want to build more CHIP compounds, but the existing ones clearly do not even have water. And
I agree with you on priority, but maybe the partnership between WaterAid and Joy, multimedia family, if Honorable Minister for Health, Honorable Minister Akando didn't know this documentary, we are bringing it to his attention. And I strongly believe that he will add the Bongo district to the list of the Mahama Cares, program. You know, recently also there has been His Excellency the President has also launched the Mahama Cares program, where he's going to invest a lot of resources on other diseases. I mean, and inject more into the national health insurance to deal with some. I mean, look, you will be shocked to hear that. And like you mentioned, when women go to healthcare facility, apart from going there to receive paracetamol, APC, and other things, they also wash out on which hospital give them adequate wash. And you could see that some of them will go to antenatal at some places, but when it comes to delivery time, they go to where there is nice washroom and deliver. And even they will tell you in the video that despite the hazardous nature of the routes, the risky nature of the routes, they will go there early, because they feel that this way water is flowing. When after bathing, they don't need to get up and be told that, look, take a bucket and go to the other community or the other house and get water. Somebody who has lost a lot of energy, after delivering, will now have to get out from the bed looking for water. Meanwhile, this entire district also has challenges with water. So assuming she goes to 2-3 houses and does not get water, doesn't mean that she cannot bath after delivering, where water will be very important for the woman after delivery for a good number of days, just to ensure that infection prevention and control is handled well, to be able to promote. So we can only call on the policymakers like Honorable Minister for Health, to ensure that with this big push coming, a lot of resources that is being pumped into the $10 billion dollars over the next few years, Bongo district is given a share. We can only appeal to Honorable Minta that, look, with the Mahama Cares program, I mean, investing in CHIPS compound, like this, even if they want to start new one, because we cannot say that those that do not have, they shouldn't give them. But others that have and need adequate wash, they should be able to invest more. But most importantly, the Parliamentary Select Committee on Health, because they are those that have oversight over this budgetary, resource allocation and all that. They should just make sure that, look, the executive does the right thing in ensuring equity in resource allocation. But even when the resources are allocated equitably, they are released. Because one thing putting the resources in the budget and another one releasing the resources for it to be done, what is supposed to be to do, just like this serious problem that we are grappling with. But because just looking at the data, we understand just about 67% of health facilities in the country have access to basic water. You were just talking about the sanitary conditions, the toilet facilities, etc. And even of that 67%, we also learned that half of that have access to toilet facilities. And it's really worrying. It's extremely worrying. And your team have been doing an extensive job. And I think even this documentary is what do you call it? Is a testimony to that. It is a massive testimony to that, because clearly this situation is not exclusive to, what do you call it, the people in Bongo. No, absolutely. Because the research I was just doing shows that even when you go to the Oti region, where I hail from, we do have issues there. You go to some other communities, they do have issues there. And these are fellow countrymen and women who clearly deserve some dignity in childbirth, because they have to suffer, they have the risk of losing their child or even their life
And if they're able to escape that, now they have to go home with some of these infections.
Yeah.
You know.
So that's the point, and you're absolutely right. You know, if you take the 5 northern regions out, northern, northeast, upper west, Savannah, I mean, Oti and parts of Volta are severely also hit when it comes to wash crisis. And so when we talk about equity in resource allocation, for instance, Oti region is also one of the newly created regions.
Yeah.
I mean, the government has to give it a priority in terms of education infrastructure, but also health infrastructure, water and sanitation infrastructure. Because look, when we talk about investing in water, sanitation, and hygiene, not because I'm in that industry, but look, among the 17 Sustainable Development Goals, if you got it right in investing in adequacy of water, sanitation, and hygiene, then believe me, the catalytic effect on reducing poverty, improve health, well-being, and all the other 17 SDGs will be easy to solve. But if you don't invest in WASH, forget it, you cannot reduce poverty. Children going to school cannot complete school if there is no adequate WASH. Because girl children go to school, they are in their menses, there's no washroom. How can they sit down and listen properly to their teacher?
Yeah.
So, I mean, so investing in WASH, in fact, WHO, one of its studies, which WaterAid also has done extensive work on, indicates that if you invest $1 in water, sanitation, and hygiene, the return on investment is $6.
Wow.
Yes.
Wow.
If you invest just $1. So when we are discussing with policymakers, especially His Excellency the President, Honorable Atuforsen, Honorable Minta, to prioritize WASH in healthcare facilities, we are talking about evidence available that points to the huge benefits, when you invest in WASH.
Yeah, and just to emphasize, because, the WASH is an acronym. A lot of people...
Water, sanitation, and hygiene.
Water, sanitation, and hygiene. It's critical. It's extremely critical as far as the well-being of our mothers are concerned. Whenever it's Mother's Day, we get to celebrate them.
Exactly.
But you look at some of the challenges they go through. Exactly. And some of these challenges, like we were just saying, are avoidable. Completely avoidable, because if all you have to do is to provide water in a health center, that shouldn't be difficult. You just have to provide poly tanks and fill it with water, and the mothers can have access to it. You just have to build some toilet or urinal, and they can have a dignified place to go and have themselves resolved. And I think this is a very, very easy problem to solve.
Easy.
We do have difficult problems in the country, but this shouldn't be a very difficult one. It should not be at all. What will be your final message, though, to especially the president?
Yes.
And I think even I'm sure sometimes you do see the First Lady also getting into this space.
Absolutely.
Even the Vice President also being a female.
Absolutely.
You do get her being even more, sensitive to some of these issues.
Absolutely.
So it's really striking. Yeah. And I think if they're watching at the Jubilee House, clearly they need to turn attention to it.
No, I absolutely agree with you. So beyond His Excellency President Mahama, and thanks to President Mahama for all these policy initiatives, we believe that as we know him to be a listening president, the Mahama Cares, program, part of the funding will be used to, address some of these critical problems. But beyond His Excellency President Mahama, Her Excellency the First Lady, Lordina Mahama, also has a foundation, where she's doing a lot of good jobs, in maternal and child health issues. So Her Excellency Lordina Mahama, we're also appealing that with the situation that most of the CHPS compound are facing in Bongo, we believe that First Lady Lordina Mahama will also come to the aid of Bongo district. And beyond the two of them, public investment, Honorable Atuforsen, should also ensure that whatever directive His Excellency President Mahama has given him, he should expedite measures to release the budget to Ministry of Health and Ghana Health Service to be able to implement. But beyond these policy-oriented people and the executive, we do also have philanthropists. You know, we have individual men and women who are rich, you know, can be able to come to the aid of Bongo district. I mean, to be able to do that. But I will use this medium to say that within our current strategy as Water Aid Ghana 2023-2028, we are available to partner with any philanthropist, any development partner that wish to extend the model that we are investing in Bongo district to Dambai, Karachi East, Karachi West, and all other areas in the country who face similar problems. Water Aid Ghana is available to be able to ensure that everyone everywhere has adequate water sanitation.
You know, one of the things that really help when it comes to championing some of these projects is when you get the public involved, when you get the public, you know, what do you call it, involved, invested in it. And that's something I want you to, what do you call it, expand on. What is it that Ghanaians in and around Bongo, all over the country, even if they are in your village, you do have similar situation, what is it that they can do to help champion, what do you call it, water, hygiene and sanitation issues, so that if it is government, if it is NGOs, they can all come on board and help? What is it that the ordinary people can do to help champion this?
So, for instance, and this is a very important point, because beyond targeting the policymakers, we have people in the diaspora. So, for instance, we have people from Upper East, people from Bongo who reside, you know, in other parts of the globe. You know, if they are in Europe and other places and are willing to help, I mean, it's very easy for them to reach out to the district health administration of Bongo, or reach out to the Bongo district assembly, or even if they want, they can reach out to Water Aid Ghana. We have all the estimates available to provide water, toilet, and hygiene facilities in any of the healthcare, you know, facilities. But beyond that, we also calling on community members. You know, when you have beautiful edifices such as we found in this documentary that we provided, the other important measure is the maintenance. You know, so people, when they are using those facilities, when they visit the healthcare facilities, they must exercise some measure, you know, to use the facilities well, you know, so that when they leave, others who follow them can also have the opportunity to use the facility. And then also, the healthcare facilities that have the opportunity to have this wash, we're also calling on them that they are internal generated funds. They should endeavor to set aside small monies to also do routine maintenance. Because when people also invest, it does not serve well when they come the next day to see one, you know, metal is lying on the floor, another one is lying on the floor.
You are generating some funds.
Exactly. But once you stick to the maintenance regime, then it's able to last longer and be sustainable.
I think that's brilliant. And we need to resolve this issue in Bongo. We definitely need to take it up. And I think we're going to keep the conversation going on, so that our mothers and you know, our sisters in that district can have this issue resolved. It shouldn't be one that should be difficult to resolve.